Hello, my name is Joan Papp, and I am the Medical Director of our Office of Opioid Safety and Metro Health. Our office was created to address the many facets of the opioid crisis in our community, which caused over 100,000 overdose deaths in the U.S. in 2021 alone. While our office addresses many contributing factors that lead to addiction and overdose, today I would like to focus on what we call harm reduction. Harm reduction is a concept that we can take a behavior or activity that is inherently risky and make it safer. We're not eliminating the risk, but reducing it. Some harm reduction interventions that we may already be familiar with include seatbelts to reduce the risk of injury in a car crash, or condoms to reduce the risk of HIV transmission. Drug use is obviously a very risky behavior. Some of those risks include non-fatal and fatal overdoses, acute infections of skin, soft tissue, bone and heart valves, and the transmission of chronic infections like HIV or hepatitis C. In the Office of Opioid Safety, we offer 3 main evidence-based interventions that can reduce these risks: take-home naloxone, fentanyl test strips, and syringe exchange. Number 1, take-home naloxone. This is the opioid antidote that reverses the respiratory sedation caused by opioids. We provide this to people who use drugs and to people who may be in a position to rescue them, like family, friends, and treatment professionals. We also offer education on safer drug use practices, making sure you're not using drugs alone, avoiding combinations of opioids and other sedatives, and testing your drugs for illicit fentanyl. Number 2, fentanyl test strips. These are easy-to-use drug testing strips that allow a person to check their drug supply for the presence of fentanyl. Fentanyl is a common adulterant that may be present in other drugs like cocaine and the fake pills commonly sold as Percocet or Adderall. We recommend that anyone who uses illegal drugs or pills, not just opioids, test the drug to ensure that they know what they are taking to prevent a fatal overdose. Number 3, syringe exchange program. This provides clean needles to people who inject drugs in exchange for used needles. This practice reduces the risk of transmission of HIV and hepatitis C among drug users and can reduce acute infections of other organs in the body. This intervention is supported by the CDC and has been shown to reduce the risk of HIV transmission by 80% among people who inject drugs. It also reduces the risk of needle sticks for people in our community by removing dirty needles that are improperly disposed of. We offer our harm reduction services in a variety of settings throughout Metro Health. We have Nalox boxes for community access naloxone if a person witnesses an overdose on the Metro Health campus, and throughout the community in high-risk areas. As a Metro Health employee, you can obtain a free naloxone kit by stopping into the Metro Health Police Department and requesting one. If you are a community member who is at risk or in a position to rescue a person who uses drugs, you can stop by our harm reduction mobile RV unit, located at 3370 West 25th Street, directly across from the Outpatient Plaza building. It's open Monday through Friday from 10 a.m. till 3 p.m. This location offers HIV and hepatitis C testing and referrals to addiction treatment services. Thank you for taking the time today to learn more about harm reduction at Metro Health. For more information, visit metrohealth.org/Office of Opioid Safety.